Hi, Sidharth. Welcome on Parenting Reloaded. And it's really an honor to have someone whom I've known closely over the years, who is one of the most accomplished medical people I know, and also someone who has cared about what he has done to do it really well always. So really, it's really an honor to have you here today.
No, hi Kavita. It's an honor to be here. I mean, it's almost parallel journeys, isn't it? We've known each other since when we were kids, and now
Yes.
we're both parents, and in our professions. And
Yes.
it's an honor to be here. Thank
Thank
you very
you.
much.
Thank you. So, in today's conversation, Siddharth, I'm going to focus on two areas. One, you from the medical field, and what parents and students can take away from this conversation from a medical healthcare aspect.
Right,
And the second, Siddharth as the parent.
right.
Okay. So let's start by talking about Siddharth the person. And tell me, what has your academic journey been like? And what kind of a learner would you say you have been?
So it's a very interesting question. I think my parents would be able to answer that a little better, but I'll try. So I was somebody who was very regular, especially in school, with what I did. So I never had, and for some reason, math and science came very easily to me. I mentioned that because I was teaching my kids, science till class 10. And I was trying to teach my elder one something in carbon and, how methyl groups keep getting added and compounds can get named. He got so fed up, he actually stored me on his phone as methyl. But at times when I want to do something, I gave it 110% always. I never wanted to become a doctor.
Mm.
So it was almost that was almost Hobson's choice for me. So
Okay.
I managed to get into, again, because of physics and chem, I managed to clear practically all my pre-medical exams. At that time, we didn't have a common NEET test. And I got into Maulana Azad Medical College.
Okay.
And even there, I was a very erratic learner. I think more because I didn't want to be there mentally.
Okay.
And then I discovered a book in my final year and a half, which at that time the way it used to be called A Short Practice of Surgery by Bailey and Love.
Okay.
It was written so beautifully and so wonderfully that it made understanding of surgery and the field of surgery not just so simple, but a lot of fun. I think I read it cover to cover on a weekend straight.
Okay.
And I just decided that if I had to continue in medicine, I was about to give up, by the way. I was applying for an MBA into to colleges in Australia and the United States at that point. And then I stuck to surgery. And for me, it has been my, whether you call it Zen or meditation, but whenever I was in an operating theater for the last 30 years, it's almost like it's almost the most peaceful place for me. It's like, people describe it when they do meditation. For me, that was the operating room and the world over. And I managed to work in a few countries in the world.
Okay.
And now I'm, as you know, pivoting in life after 3 decades in the clinical profession to still being associated with the profession, but doing something more proactive so that, we're not always, because as doctors, we've always reacted to a patient's problems.
Yes.
We've never really been proactive
Yeah.
in preventing illness
So
right from the beginning.
prevention is better than cure.
Always, always, always.
Okay.
And now we have the reason why it gets more relevant today is that because of the advances in technology across the spheres of life and the newer understanding of what exactly is health and what influence can we do put on it to not just increase years in our life, but also add life to our years, which is really the motto of what we're doing now. And how do you define health, and what are the parameters to sustain health?
Correct.
What are the roles you can play as doctors to avoid seeing a lot of doctors a lot of times, because it's not really needed if you look after yourself properly. So that's what we're going to do. It's a holistic approach.
Okay.
So if we look at Kavitta Bedi
Yes.
as an individual,
Yeah.
so it won't just be about concentrating on one aspect, but we will look after you at both local level as well as offer you the best of international opinions that you would ever require through our services. So we're not a concierge, but much like you have family wealth management funds and firms, so now we are introducing the concept of a health management firm. So we're not going to just be a concierge. We're going to manage your health. We will tell you what is required for you to maintain that so that you can avoid the bullets. We call them dodging the bullets. So we can prevent your cancer risk from going up. And even patients people who become members, if they've had cancer, we will ensure to the greatest possible extent an overall method where you can avoid recurrence almost entirely, and avoid the infections, avoid the cardiovascular risk, the heart attacks, the strokes, all of that fairly significantly, so that the next 30 years or 40 years of your life are lived with as close to full fitness as possible.
Wow, sounds amazing. I'm going to focus on something that you said right at the beginning when you started. You said I didn't really want to become a doctor.
Yeah.
At that point of time, were there open conversations with anyone except yourself while you were going through this thing of should I do medicine, not do medicine? What was it for you as a child back then?
So it was interestingly enough that you asked. I only wanted to do one of two things: either become a professional sportsman or become an actor.
Okay.
So the third thing that sort of put its head up for me at that time was the thought of becoming a lawyer.
Okay.
Because I thought I might be decent at it. And I was told that if I didn't become a doctor, I could start moving out of the house and, planning a life for myself. Which sort of narrowed down the possibilities at that point for me. It was, we are very different as parents, Kavitta.
Yes.
You'd remember back in the day, it was a very different style of parenting.
Yes. Okay, hold that thought.
Yeah.
So, it's very interesting you're saying this because even today, Sidharth, I work with students while they are very young and in middle school and high school. And the amount of conversations where you often have to become that bridge between parental aspiration, student aspiration, student capability is still very real today. So I think any parent who is managing to have that honest conversation with their children and is allowing them that area of exploration really deserves to pat themselves on the back, because for a large majority of parents, even today, some of these things are, like you said, non-negotiable.
Yeah, I mean, I think you're quite right with what you said. I think a lot of times, without realizing it, we put our child's aspirations in inverted commas, not realizing that, not taking a step back and thinking, are we superimposing or trying to superimpose our own aspirations of what we think should be right for them?
Absolutely.
Rather than focusing on what is great for them. And one of the examples, if I can give you, it's my elder one, fabulous with language and with the social sciences, but he had to really work hard to stay afloat in maths and science. Now, an area which for me
came so naturally
and to an extent even for my wife, because she's an architect.
Right.
So we had to do all of that, and we did it. But I mean, he did fairly well in class 10 when he had everything, but step into class 11 when he gets into arts, and we had no problem with his. So I have, just because we did it doesn't mean that. So I think what you have to do is recognize your child's strengths and then play to those strengths rather than, and I remember reading this somewhere in a biography that Gunther Bosch wrote about Becker. He was Boris's first coach when he won Wimbledon, and how he used to make Boris practice. So Becker had a very suspect backhand, but a phenomenal forehand. So he said, as his forehand got better, it would almost translate into his backhand becoming better. So before a match or an important tournament, he would drill that forehand till he got so much confidence in himself that he could do anything. And I think that's a key learning experience, even to parenting. Recognize your child's strengths rather than shy away from them. Because what might come easily to you may be difficult for your child, and vice versa.
Absolutely.
I can't play an instrument or sing a note to save my life. my elder one can. I
Hmm.
mean, so it's different, courses for different folks. And I think
Absolutely.
as a parent, you need to be constantly aware of that and don't negate or don't push your child down because they don't have the same things that made you successful or made you what you are.
Absolutely. Now let's put on the medical hat for a bit, because
Sure.
we jumped into our parenting conversation sooner than I had thought we'd get into it. But I think it's just top of mind. And I think because we're both very involved parents, I think that's why it's just a part of who we are actually. Okay, but as a doctor, Siddharth, tell me, today we see stress all around us.
Mhm.
We see stress which is academic, we see social pressure, we see digital screen time pressure, we see just the pressure to fit in, this Instagram life that seems so perfect for everyone. What are early telling signs for a student who's facing all of this and is unable to handle it?
It's a good question because, it's having followers on Instagram or Facebook. I mean, I'm showing my age now by talking about the social media, which
Yeah.
the current generation probably
Yeah.
doesn't even use.
Yes.
But
let's say social media of any kind,
yeah,
validation
of any
on
kind,
social media.
of any kind. I think it's like having 1 million followers there is like being a billionaire in Monopoly. I mean, it's not real.
Right.
Okay, so if you succumb to that pressure, I can only tell you as a parent whatever we've tried to do. We were both working ourselves and a nuclear family, so we decided on principle we would never have cable TV at home, and those are the days of cable TV, right? Your dish TV and all.
Yes.
So we've never had TV at home, hence no hours in front of the idiot box. The kids got access to the iPad, but at that time we hardly had any social media presence ourselves.
Correct.
So they got into it, but at their own pace when they were 16 plus. Again, not a rule imposed by us, but I think as parents you have to give them a phone today because they are going out for classes and things like that. So there has to be some way to reach them and keep them safe. But it's a very important question, and I think I'm still a little vexed by how you can control that because they're really smart at it and really slick at it, and you've got uh, you know it was addressed so wonderfully, and I think I haven't seen the whole of it, but adolescence, where the parents just keep saying, "But we thought we were doing a good job. This kid was just sitting in the room and going through the phone." I think it's a very, very important, because if you know medically, the blue light on the phone, if you before going to bed, if you look at your screen for 2 minutes, it's like downing 20 espresso shots.
Wow.
Okay,
so parents, that's a medical fact. It's not just jargon.
Yeah, because the hormones get completely out of kilter. To sleep, you need a hormone called melatonin to kick in. To stay active, you need dopamine to kick in. The blue light and the screen just makes the dopamine override the melatonin. So what happens is there are sleep disorders. Because of the sleep disorders, the stress increases. So because the stress increases, your learning disabilities start coming in. Whether it's and it manifests itself, of course, in poor performance, which leads itself to again, having less self-belief,
right,
which then again feeds a negative feedback loop into feeling more social pressure. And when you talk about stress, you have to realize that stress on a medical level increases what is called general inflammatory markers in the body. And these inflammatory markers are things that will keep accumulating and causing diseases that would have otherwise not been there. We were very lucky that we grew up in a time where the biggest challenge for our parents was to catch our ears and bring us in to actually study. Here, I find this with this generation of children, we're catching their ears and throwing them out of the house to go and exercise.
Absolutely.
It's so they never had any. I mean, social media for us was getting together and going to Chanakya for a movie together. So that was it.
Also, there is a lot of, so one is pressure that is induced by all these social demands. The second is that today parents are pushy. Success is the new badge of honor to wear for yourself. So if you've not done it in your lifetime, or if you have done it in your lifetime, you want your child to do more. You want them to be a part of that. So one is, yes, as a parent, every parent wants success for their child. But it's almost become cocktail conversation chatter
Yeah.
that what is my child doing? If they are younger, what classes are they going to? Do they have an Olympic coach who is coaching them swimming in the, in the private pool? Or if they are studying for an exam, for the, the large mass exam, then which tutorial classes have they joined? So across the gamut at different levels, it's almost become a social badge that you wear. As a result, we find children who are on the surface seeming very motivated, very driven, putting in unreal hours. But medically, what happens to a young body when there is undue pressure and they don't take enough time to let off steam in whatever way they let off steam, or just sort of relax and rest?
So if you talk about, since you mentioned training,
Hmm.
we've had family members who are very good at a certain sport,
Hmm.
working really hard towards it, and family friends as well whose kids have done that. I think sport, if you're doing a sport,
Right.
it's by definition going to give you a healthy lifestyle.
Okay.
Because if you're really serious about training, you will make time to rest. You will not be on social media that often. You won't eat incorrectly.
Right.
And by and large, I think that if you're doing that, then I think that should be encouraged. But again, you need such special skill sets to do that not everybody can succeed there.
Yes.
And I mean, what is your
And
definition
then,
of success?
and if you're not succeeding, then that's an unset pressure on you to
Yeah,
also
again,
succeed.
again, it's every sportsman who, having been one
Absolutely.
myself, every time you get out onto a field, every time you get out onto a court or into the pool, you want to win. And that has to come from within. If you don't have that, you've already lost before you started, right? But there's only going to be one winner,
Mm.
right?
Absolutely, yes.
And I think the only sport that you play against yourself is golf. The rest, you always have an opponent,
Yes,
right?
true.
I think you have to remember that it's in sport, and I think in life, it's not always about winning.
Mm.
It's also learning how to take the loss
Mm.
and learning from that loss.
Yes.
If you don't learn from a loss, if you don't learn from a mistake, then you're never going to go forward and you're always going to be stuck in a rut. So I think parents should allow their kids to make a mistake. In our country, I think, and please correct me if I'm wrong, people perceive a critique
Mm.
the same way they would perceive criticism.
Correct.
And there cannot be a bigger difference between a critique and criticism.
Yeah.
Every one of us who've done whatever they've done, have had people at critical junctures in life who can give them a critique. Because what does a critique tell you? Well done, but you could have done it better in this fashion,
Yes.
or maybe at that point.
Yeah.
Or, so it always gives you room for improvement.
Absolutely.
So I think instead of criticizing our children,
Yes.
if we think their performances are not up to their mark, give them a critique. And I'll give you an example again from my own family. My younger one, especially during COVID years, it was all across the board. It wasn't normal lifetime, especially growing up.
Yes.
If we were finding it difficult
Imagine
as
the children.
the elderly, I mean, the teenage brain is the most fertile and developing thing in the world.
Correct.
If you are going to lock that up, I mean, and it's not their fault. It's not, I mean, you can't complain about
It just
anyone.
was
It just happened.
extenuating circumstances.
It's just extenuating circumstances. And I was very afraid for my younger one. But he hit a point in his college year, at his first year, where he reached a point where he was at the verge of possibly, being asked to leave.
Okay.
Without me saying anything to him or his mother, just saying, listen, buddy, I think you can do better. He got a hold of himself, took that critique in, and turned it around to the point where, he never looked back after that. So I think criticizing is the easiest. Giving a critique is important because it gives room for improvement for the person that you are
Yeah.
talking about.
Absolutely. So, as a mentor, often there are positions I have to take, which may not be the popular position.
Exactly.
It may not be what a student wants to hear. And I often term it as I have to give you feedback. And this feedback is not a criticism,
Yeah.
but this feedback is honestly telling you from a position of dispassionate observation. See, because I'm not emotionally involved in that situation, because it's not technically not my child the way I would be.
Yeah.
But at the same time, I'm viewing it objectively and I'm giving you feedback that allows you room for reaction and improvement.
Exactly.
And I think that is so well said. And I think a lot of parents should hear very clearly what you're saying, because a lot of reactions at that point of time, when you have a situation where your child is not doing well academically, it could mean a situation that might alter their future if an action is taken or a decision is taken. And then to calmly deal with that situation and help them navigate it. I think that's what parenting is about.
Exactly. And you actually end up doing that practically all your lives, because you will till you move on to to your other destinations. You are always a parent once you become one. And that's what kids, even if they don't actively require it after they've, got great jobs or got good businesses, whatever, but they still know that they have a shoulder that they can lean on. And
Is it important to build that fabric of leaning on and communication important right from the word go?
yeah, I think it is, because if you don't build it in, it doesn't happen organically. You know,
Okay,
if you,
so as a
if
dad,
yeah,
what steps? Tell me 3 steps you have taken over the years to build a strong communication with your children.
I think be honest with them. Again, don't criticize as much as possible, but critique, help, and it's always that line from Harry Potter: "Help is always given to those who seek it at Hogwarts." So become a Dumbledore. Great person to model yourself on as a parent, and uh, you know, it's once they realize that, and always be prepared for no reprisals. Once you set the ground rules, but you have to set the ground rules from the beginning. And I've got 2 young men now. I've never raised my hand on them. I've never raised my hand on them. And I think, and they are completely honest with Matisha and me, and they'll tell us whatever is going on, whatever help they want. It's always, and as they've grown older, the sentimental value still stays the same. Of course, I mean, when they were kids, you're picking them up and holding them here. Now they're at 19, 22 plus, they're physically fit enough to lift us. So, I mean, but that bond is created right from the beginning, and a lot of empathy, a lot of the no reprisals. Whatever you do, please have the ability to come and tell mom and dad about it. We'll fix it. We'll help you, but we will never give you the wrong course of action.
Yeah. And we might not be able to fix it always,
No.
actually, Sidharth.
No.
But we are here to listen, and we are here to support.
Yeah, exactly.
No matter what happens.
Yeah.
So, a rule I always had with my daughter: I don't want to hear from someone else
Exactly.
what has happened in your life.
Exactly.
Good, bad, up, down, happy, sad. The ear is always there to listen. The hand is always there to hold. And we will figure it out.
Well said. That's really the policy we've had with the kids. And I think that's important, because if you are always giving orders, that doesn't work at all.
Yes.
If you are never there, that doesn't work.
Okay, I'm going to pause you there. You're from a setup where you said nuclear family. I know that both you and your wife have had hugely demanding, hugely successful careers. How can you be present for your children without being away physically from the home for a large number of hours in the day? Because you're pursuing your own excellence, like a large portion of us are today. So tell me a bit about that.
So they've always had access to us if required, on the phone. And unless I was scrubbed and actually operating, and we we've both known where the other person is. So if Matisha was traveling on work, I would make sure that, or try and make sure that my days were not heavy, so that I could be with them.
Right.
They knew they had access to me 24/7.
Right.
And when I was in hospital, it was easy. I mean, if there's a problem, get here. We'll sort it out for you from a medical point of view.
Right.
And it did happen a fair number of times. But that was one way to handle it. We never really had an issue in terms of too much of discipline issues, or especially till high school. There was never an issue. If there was, then you made time out to go and try and figure out what was going on so you could come back home. But fortunately, like I said, there weren't too many of those times. And they always knew that we were both of us were just one phone call away. If required, we would be there physically.
Right.
And it's just something that happened. Fortunately, when the field that I was in didn't have a lot of they had no emergency, as a matter of fact. So that helped, because then that meant that you weren't,
you were able to manage your time.
Yeah, it's the only thing I've always said. I think if you can manage your time properly, then you can fit it pretty much everything into your life.
And do you think it helps to demonstrate to children that we will prioritize you and your needs when needed?
Yeah, I think it's demonstrate. They see it for themselves.
Yeah,
They
so
realize,
it's sort of through your actions, really.
yeah, of course.
Right?
Of course, right from, I mean, come on, I don't know how many times your parents ever went to school when you were this thing. My father, I think, came once when I got some award or something. My mother must have been there 2 or 3 times in the entire 13 years.
Right.
Here, we had to go every month for that blessed parent-teacher meeting. Yeah, so I mean, small things like that. I mean, you're expected to go even now in kindergarten.
Right.
So that's just what it is now. You can't, and like I said, because we're a nuclear family, I grew up as a child in a nuclear family, and my children have also grown up in one. So I think they've always realized the all for one and one for all. I know I'm plagiarizing from the Four Musketeers, but that's how it's been always.
Okay. Now, from a health standpoint, today we know eating out is a lot. We know exercise is on the downhill. We know there's a lot of screen time. As a doctor, if you were to give 3 pieces of advice to parents, what would those top 3 be? Keeping in mind now you're involved in something where you're looking at health holistically and kind of what sets a good pace?
So I hope people don't misunderstand me, but as a parent, one of the challenges you face in terms of peer pressure as well is the quality of nutrition for your child.
Okay.
I'm not naming them because that might be licentious, but there are all your fast food chains that use poison to cook in. And by poison, I mean refined oils. And one of the advantages of the lockdown in COVID-19 first time was that it stopped that. Okay. Now, understand where I'm coming from. And I'm talking with both my hats on, as a parent and a doctor. So by feeding your child that food which is soaked through in refined oil, which is heated multiple number of times, you are basically cooking in poison. Those oils, when they go into your body, it's like a terrorist attack happening on every cell. And therefore, you see today the number of food allergies. And it just doesn't affect the gut. It affects the neurons in the brain. Okay, so there is more people, as I've been speaking to schools and colleges, kids with learning disabilities are increasing.
Yes.
And you have young age cancer, which is happening. And if you look at the National Institute of Health in the US chart of the rise in cancers, and you go back 10 years to that or 15 years to that, that's the rise in the profit of the fast food chains. And that graph is still continuing. So there are very few safe oils to cook in.
Okay.
There's ghee, butter, extra virgin olive oil, and yes, you cook in it. You don't. So that's a myth that you only drizzle.
Okay.
Okay, you
So
cook in
all
it.
that talk about smoking
Yeah, smoking
points
point
and
is that. So important point is something called oxidation point, where the oil breaks down. All extra virgin olive oil has an oxidation point of 250 degrees Celsius.
Mhm.
I don't think anybody cooks at that temperature.
Okay.
Right.
Okay.
And having lived and worked in Italy, I can assure you that every Italian household only cooks in extra virgin olive oil.
Okay.
Okay. If they want to use an alternative medium, it is either clarified butter, which is ghee, or butter.
Okay.
And the French do the same. So if you look at the risk of heart disease.
And are those communities the ones with least disease and
Yeah.
maximum longevity?
Yeah, I mean, look at Sardinia. Sardinia is an island of Italy, and it's ripe amongst what are called the blue zones in the world.
Yeah.
What do they eat? It's a high fiber diet, fresh food. So your protein source is either caught fresh from the sea or whatever, the lamb or cow, whatever they eat there, which is local. A lot of family time. So that community time, the community living, we are going away from that. We need to get back into that, because if you can stay together as a family and have fun as a family, I think it will decrease stress. It's a great way to reduce stress. If you try and solve every problem in the world on your own, you can't. I mean, no one is Superman. Even he had a problem with kryptonite. So, we need to learn from these places. And rather than get onto fads, so people say, oh, I'm on a keto diet, I'm on a carb-free diet, I'm on a lactose-free diet. Hello, first, let's address the problem. What are you eating in? The other oils are, of course, avocado and mustard oil, which are completely safe to eat in. You go out to any restaurant, in even 5-star hotels, very few of them will use any of these. They're all making your food in refined oil. So if you really want to take care of your kids' health, not just physical but mental, stop them eating this food. It's
poison.
It's poison, right? And if you do that, you'll find a lot of change in terms of mood swings. Irritability will be less, focus will be sharper, and of course the other is sugar. White sugar. That we only have two poisons: white sugar and vegetable oils. If you can keep your kid, if you really want your kid to be healthy, keep him or her away from these two things, because we've actually, using these two things, we've actually invented and propagated disease that did not exist about 60 years ago.
Wow.
Okay, so you want to really look after your child, make sure this is not on the plate.
I also read that India has an alarming increase in childhood obesity and childhood diabetes, which is directly related to these two things that you have just spoken about.
It's completely related to them. I mean, when we were growing up, we all looked like we were coming from some starved nation and always eating like we would for 3 people. We were eating properly cooked food, home cooked food. I mean, I had the odd occasion when we were taken out, but
it was for a treat, or it was for a special occasion or something like that. It was not the norm.
It wasn't the norm. Today, if people are eating home cooked food after going through the pandemic lockdown, a lot of people became very great chefs. I have to admit, but if you're not cooking the right thing, and it's not just your children that you're preventing from happening to. If you want to look after your own health, because again, as a parent, if you don't look after your health, how are you going to look after your kids?
So, it's very interesting. Studies have shown that what children see and perceive, and they constantly imbibe from the word go.
Yeah.
So, if it's normal in your house, a dinner table conversation that, oh, dad came in the paper today, right? You're just setting that unspoken expectation of achievement at that level.
Mm.
And we don't, it's not like we're mean, we're being mean or we're setting the bar and saying, you must do this. So the first thing is eat well yourself to make sure they learn to eat healthy.
Yeah.
So nutrition is one. What would be the other two things?
To some extent, again, as I said, you need to look after them emotionally. And that hand, then no reprisals. Come and tell me whatever's happening in your life. I'm not there to criticize.
Right.
I'm there to offer you a critique, to make you a better version of yourself.
Correct.
That's, for me, that's success. People ask me what is success. It can be measured monetarily. It can be measured with fame. No, nothing. Be the best at that, despite not wanting to do medicine. When I actually got into it, I got into surgery. So I decided then, be the best version of yourself that you can be, because nobody's going to come and do it for you. So that's what you have to teach them, that be the best versions of yourselves. Because if you are, then you're truly true to yourself and have the guts to do that. You will not face a lot of this social pressure. You will not face the stress of having to constantly prove yourself. I mean, look, not everybody is a Virat or a Sachin or a Leo Messi or a Ronaldo. That's just the right genes, right? But these people work so hard. They like, or all they say, and I've heard this in various interviews about them, is we have always tried to be the best versions of ourselves.
Yes.
We don't match up against anybody else. And I think that in humility, is seen. If you don't see it in your parents, you'll never, because I think humility is again something that drives stress away.
So interesting.
It keeps you grounded. It makes you, again, I keep giving my examples from sport, but my hero during school days was Sunil Gavaskar. I remember him saying, I'm as good as the next ball I face.
Yes.
And I applied that to my life, where I just said, yes, thank you very much, and this and that. But for me, I'm as good a surgeon as my next patient, not my last 2,000 surgeries. So if you're mindful about that, you will stay focused, you will stay in the now, and whatever gets said about you, because the higher you go, if you are getting praised, you also leave room for abuse and criticism.
Yes.
If you want to take one, you have to be able to deal with the other. So
True.
Humility allows you to, it's like, it just washes over your back, whether it's praise or whether it's, abuse, it doesn't affect you. So
I think humility, I'm going to add that. So, often I'm asked that what does the next generation need to succeed? And, I talk about resilience, I talk about adaptability.
Yeah.
But after this comment, I'm going to add humility to that list.
You have to.
Because I think humility, where everyone is living this larger than life today, just let's look around us.
Yeah.
We're all in this mad race to go where?
Well, we only have one common destination.
Yeah, but we forget that.
We forget that.
Right? But I think, so we're not saying that don't push yourself to be the best version of yourself.
Yeah.
But at the same time, be humble enough to accept the accolades as well as feedback.
Brickbats, yeah.
Yeah, to become
You're
even better.
You're going to get both in life.
Yeah.
And if you don't have that space where you're honest to yourself, I think you will get affected. And to be affected by both, you become an affected human being, which is really not where you want to be. But it is hard to do. I remember one of my mentors, who I think was probably one of the greatest influences on my life. He taught me one thing. He said, when I was doing a clinic with him, the OPD, he taught me, he said, Sid, just remember, anybody who's sitting in front of you has left half their brain at the door, because they're so hassled.
Yes.
If there wasn't a problem, they'd be sitting very happily at the pub next door. So please don't have an ego. The disease already has one. You don't need to acquire it.
So profound.
Yeah. So, I mean, I've always tried to be that in the profession that I've been in, and even to a large extent in my personal life, it's very easy to say, "Oh, I'm so and so." No, I don't need to say that. When somebody else says that about you,
Absolutely.
that carries weight. Why do you have to say about, there's a saying in Hindi that a half-filled vessel of water makes a lot of noise.
They are the ones which make the maximum
noise. Yeah. So if you're content with yourself and full, and learn to be content with yourself, find peace first with yourself.
Yes.
If you don't have that, you're never going to find. People keep talking about inner peace. What is inner peace?
Yeah.
You should be happy with the version of yourself that you are. If you don't love yourself, nobody else will. Don't expect other people to.
Yeah. Absolutely. Now, you are a doctor, your wife is an architect, traditional as they come careers, right? When your children chose alternative paths to follow, and they must have taken this decision fairly early in life, because to study medicine or architecture, there are certain subjects that are a given, there is a certain path, there is a certain preparation. So you must have known fairly early in their childhood that they possibly would not walk the same path as you both. How did that feel as a parent? And also, tell me a conversation or an incident that stands out in your mind when you tackled this. And what would other parents watching this sort of take away from that?
So when you're very right, we did know fairly early, especially with my elder one. I think that was 10 years ago at least. And the conversation was when he made a movie. I think you came and watched that one.
I did.
That was when he was all of 11 or 12. He wrote the script himself.
Yeah.
Yes, it was based on a lot of what he'd seen, but still the effort of writing a 90-page script. People laughed at us when we told them we're making a movie. But, how did I feel? Very liberated, as a matter of fact, and very happy because we were here in a position to be able to give them the space to do what they want. It's simple. If you do what you love, you will love what you do.
Yes.
It's very simple. And that is a great mantra for success. If you're being forced to do something, you will always be unhappy. So why would I, as a parent, would you ever want to see your child unhappy? No. Simple. So help them. We are still learning how to navigate this.
Okay.
It's not that I don't have Harry Potter's wand.
Yeah.
Right. So.
But that's true of any parent, right?
Yeah. So we're still learning how to navigate them in the best possible way to do what they do. I mean, the second younger one has also made a decision to do it. He sat with me, couldn't make up his mind whether he wanted to go to the UK college or the US. I just gave him the pros and cons. I said, look, you're going to be in two of the greatest metropolises in the world, London and New York City. How could you go wrong with either of those? Now, this is my opinion on what the pluses and minuses of one city versus the other are. And I think, according to me, you should take this. He thought about it. It's not that I forced him to do it or his mother forced him to do it. He thought about it, took the call to go to New York. And, he met the right people.
Yeah.
He's doing well. He's got his own company now. He's 19. So, it worked out. But yes, you have to be open with them. If you tell them not to do something, give them the reason why because as they grow old, we have to realize we're forming young adults.
Yes.
The way you talk to them now is very different the way you did 5 years ago, 10 years ago.
Yes.
So we knew a good decade or so ago that there was not going to be a doctor or an architect in the family. And we were fine with it.
Do you think your recent pivot to create a legacy that your children can inherit? Because in the Indian mindset especially, there is still this huge thing of legacy creation. There's also this huge thing of, my child will take my name forward. And it is a fact, right?
Yeah.
I think there's a small percentage of parents and society that is trying to have this newer mindset. So do you think your new pivot into your healthcare
venture.
that you started has got something to do with you making peace with the fact that your legacy as a medical professional will not be carried forward by your offspring.
Nobody can carry anybody's legacy forward.
Hmm.
Your legacy is your own,
Correct.
right?
Yes.
It stays with you till you're alive.
Yeah.
It dies with you when you're done.
Hmm.
Okay, so I'd rather, and also there are a lot of reasons which I spoke to you off air
Yeah.
of why I did this, and one of them again, never retire when people are asking when.
Hmm.
Always retire when people are asking why. Okay,
Well said.
so that's it, and I think, like I said, I had no problems. You form your own legacy. Nobody can take it forward. So that was never a concern to me.
Hmm.
Yeah, if you are in the business, or if you set yourself up as a business,
Hmm.
and you think that family involvement will take that business forward, you can plan for it. But that is much like health planning, wealth planning, now health planning. The succession planning has to be mapped out from a very early age. And if you realize that your children do not have the skill set
Hmm.
to take that forward, I think you need to pivot very quickly. Again, like in most sport, it's made by footwork. It's not just what you do, but if
Yeah.
your footwork's wrong, you're going to get out.
Yeah.
Okay,
Yeah.
it's the same in life. If you need to be able to have nimble footwork so that you can change tack
Yeah.
to suit what is right for your family. So
this is making me think of, we keep talking about children needing to learn to grow in life. I feel parents need to also continuously learn
oh,
to
absolutely.
have this ability to pivot when needed.
Yeah, I mean, we all, the day I feel the day you die is the day you stop learning,
Hmm.
or the desire to stop learning.
I don't just mean learning that, I also mean the fact of keeping your eyes, ears, and heart open to the
Exactly.
fact,
I
like,
agree.
your child may not want to do what you want them to do. Forget even following your own profession. Let's say, as a parent, I think my child should do this,
Yeah.
but the child may not want to walk down that path.
Yeah.
And you should be open to having that ability to imbibe that and sort of make your peace with it.
I couldn't agree more with you, Kavita. And what we forget is that everybody wants their kids to earn, right? Earn name, earn success, earn fortunes.
Yes.
Please understand that as a parent, you have to give them the bandwidth to learn. Because if you don't learn, your ability to earn will be substantially degraded.
Yes.
And so, and again, it's something that you have to be open to as an individual all your life, like you just said. You have to keep learning. I mean, you're never too old to learn. And who's the only perfection in the universe is God.
Yes.
So
Absolutely.
you have to keep wanting to learn, because people who have curiosity, who want to learn, want to increase their knowledge about everything. I mean, I don't know if you know, but history is one of my favorite subjects, even now. And I love to read history. I love to read and factual history. So you have to keep learning. You have to keep evolving yourself. You can't just stagnate and say, I've learned whatever I had to learn. No, that's never going to be the case.
Okay, so we've had all these lofty conversations and ideals about, good parenting, being a learner. The on the ground reality of the Indian education system, I know there is a lot of reform happening.
Mhm.
I think I also know that now there are thinkers. I know action is happening even on the ground. But fundamentally, I feel there is a gap between what we are taught, how we are taught, and that applicability in the real world in every profession.
Yeah. I mean, I can only answer for mine.
Yeah. So I wanted your opinion on what do you think can be done to make the medical field more aspirational, because more and more students are now saying medicine is a very long drawn journey.
Mhm.
And I think this stems from the fact that success has been made to look like a 2-minute noodle
Uh,
on social media.
yeah.
So more and more students and more parents are now saying, no, medicine takes too long, right? So a lot of the best brains are not really actively pursuing medicine. The second, what can the Indian education system do to make it more applicable and successful in the real world?
Ouch. So, as far as medicine is concerned,
Why the ouch?
very interesting questions.
Okay.
And as far as medicine is concerned, I think, yeah, you're right. That whole mindset, when my generation, when I got into medical school, it was not just a slap on the back for me, but a pat on the back, sorry, for me, but it was a huge honor for the whole family.
Exactly.
And yes, it takes long, but again, that same, you have to learn to be able to earn, and it takes you. There are no quick fixes, but are there quick fixes in anything in life? If you have to be able to reach success, yes, you can do a startup at a young age, but your chances of failing in that startup are much higher because you don't have the experience. So therefore, you must be prepared as a child and as a parent of a child, that yes, that startup is going to hit a lot of choppy waters. But you have to tell the child that, look, take learning out of it, because it's going to teach you real life issues. It's not going to teach you bookish issues. And it is hard. And I completely agree with you. I wish I could fix it and say, no, you need to go into medicine. Conversely, I've actually met people from business families who've said, no, we want to do medicine. And it's actually not just an Indian problem. It's an international phenomenon. Today, I can tell you about the UK. 68% of the graduates are females who do not want to necessarily do the heavy lifting. They want a balanced life, which I don't blame them for. So suddenly you've got a generation like ours, which is looking 20 or 30 years down the line. Will we really have specialists, not just in India, but across the world, who will be able to manage us when it's required? So it's a problem that needs to be addressed on a much bigger scale than everywhere. And yes, we did not have. What was the problem? What were the choices for us when we were about to get into university? Very limited, right? So if you were from a professional family, you went and did what your family did.
Correct.
Nobody had the thing to think out of the box. Think today, the fields that are available for kids to explore.
Absolutely.
So it's it's a difficult question to answer, because it needs to be covered on so many fronts. And I say today to people that I said, if your child is interested in medicine, truly saying, I want to do this, encourage that, because when that passion is there, that will take that person through. Yes, it's a long road, but it takes a long time to even make a success in a business. It's very rarely that you get a Mark Zuckerberg or.
Yeah, but even he took a long time to become successful the way he has with the product he has.
Exactly. So people don't see that. People just say, 19, when he was at Harvard, he did this. Yes, he did, but that journey to get to Meta today it's been a long one, and a constantly hard working one with a lot of issues.
Okay, let's wrap this discussion up with something that's very pertinent and on everyone's mind: the use of technology in medicine. Do you think a time will come when technology will replace the human mind in medicine?
Can't.
Okay.
I'll tell you why.
Yes,
because
please do.
Every human being is different. And I mean honestly different, because our genes have so many methods of reacting and replicating to the environment that it's very hard to predict. Okay. You can predict it to a certain extent, but not with any 100% accuracy. Yes, AI will learn, but what I can see of you as a doctor, when I see it through my eyes, I will read certain features in you. I know, and my brain is already thinking, I need to make these suggestions to Kavitta.
Yeah.
What AI is fabulous for is that the number of hours that you had to spend researching for something,
right,
that opinion is given to you. Now, AI can give you a generic opinion, but I have to take into account to treat you fine, brilliant, best opinion from all the available excuse me, medical literature. But is it really applicable to you? Or can I tweak it a little bit? So it is there for me to use. And that's what we're going to do, especially in this. And that's what's being actually done. But to say, oh, it'll replace human beings.
It's not going to.
It will if we let it.
Right, right. So I think one of the things that I tell my students is it's non-negotiable to familiarize yourself with technology.
Yeah.
But there's no need to be scared of it.
I mean, you cannot be scared of it. And if you have a situation which can potentially develop where you might end up losing your job to the AI, well, then do something about it. Improve your skill sets, add some skill sets that will...
So continuous learning, agility, get the feedback, and act on it.
Act on it, exactly.
Yeah. So thank you, Sidharth.
My pleasure. Thank you.
This has been an amazing conversation. I think there's so much for parents and students watching this to learn. I think from a parenting point of view, you've been candid, you've been open, you've been honest. And that's what these conversations are about, to just get to the root of what we feel as parents and how each one of us navigates that journey. So hopefully our listeners and our people who are watching us, get something from these conversations. So thank you so much. It's been an absolute pleasure.
Thank you, Kavitta. It's been a pleasure as well.
Thank you.